Okay, for scenario 3, we're going to be performing the navicular drop test. This will test how far the navicular tuberosity will move from the neutral or relaxed position to the standing position. We're going to start by palpating and finding the navicular tuberosity, and then we're going to mark it. And then here we will take a note card and measure it from the relaxed position. And then I'm going to have you stand. And then we're going to measure it again from the standing position. And then here we will be looking for the excessive drop or pronation. And here you can see this is from the relaxed position and this is from standing position. So there's neither. Okay, so now we're going to be doing the Feast line test, and we're going to be looking to see if the patient has congenital pes planus or functional pes planus. We're going to start by having our patient seated with the leg extended and the ankle in the relaxed position. And then the first thing we're going to do is take the patient's ankle and we're going to locate the medial malleolus right here. And then we can draw an X. And then we're going to locate the base of the first metatarsal here. And then once you have these two dots, then we're going to find a flat edge, which I'm going to use right here, and we're going to connect these, and then you should have a straight line. And then from there you're going to palpate until you find the navicular tuberosity, and then you're going to make a mark. Hers happens to be right on the line. We can see that before the patient has even stood up that her cross was on the line. So we can go ahead and cross out her having congenital pes planus and assume that she has functional pes planus. But to be sure, we're going to go ahead and have you stand up. And we're going to have you put your feet shoulder width apart. It's about 3 to 6 inches. Relocate the malleolus and relocate the fifth, or the navicular tuberosity, which is about right here. So since the X is lower than the original X, we can assume that this patient has functional pes planus, and this can also be a possible indicator of hyperpronation. Okay, so this is the windlass test, and we're going to start with the patient relaxed, and as you can see, you can observe the arch, and if the arch drops when the patient stands, it indicates supple pes planus. And then, as you can see, it did drop slightly. And then we're going to have the patient stand and perform a heel raise. And in the presence of supple pes planus, the arch will reappear. Here it is. And if the patient has plantar fasciitis, this test will cause them pain along here towards their heel. Does that cause you any pain? No. Okay. This is a test that has high specificity and low sensitivity for detecting this.